Look at another measurement, which is kind of like a scale that every medical professional should have. So I can use this scale to determine if somebody has been feeding well or not. So we call that the arm muscle circumference. So arm muscle circumference is I'm actually attending to a patient and I'm trying to use my tape around their arm. So it's not for fashion. I'm not a tailor either. I'm trying to look out for some medical information. Okay, arm muscle circumference. So what is an arm muscle circumference? It's one of the anthropometric measurements we use. So they used to estimate the muscle mass in the upper arm. Of course, it's very accurate in children who haven't started doing weightlifting. But in adults that are hitting the gym, you can get a wrong result. Do you understand? But if you go to pediatrics, they call it the mid upper arm circumference. That's the MUAC. Is one of the first things you must know in pediatrics. But for adults, sometimes you can't really depend on the results. Do you understand? So it's particularly useful in accessing what nutritional status and dictating if you have a protein related malnutrition in clinic and public health settings. This public health is when you are going out there in the field, you are going to the villages and you are seeing if children are being fed well. Mid upper arm, very important in pediatrics, but in adult medicine it's not really something that we always use. So the circumference of the upper arm after subtracting the contribution of subcutaneous fat. I get in it. So it provides an indirect measurement of lean body mass, only your muscle. They don't measure your fat. So it helps to evaluate if you have been eating well. Okay? So in cases, they use it for what? Malnutrition, especially in children, in adults too, but you can't really rely on it on adults. I'm actually emphasizing this, okay? Also, they say also they monitor waste, muscle wasting. That you have all those chronic disease conditions that are making you becoming thin, cancer, HIV, kidney disease. I cannot be. Every time I come to the clinic, I measure you. Okay. So how is it measured? You know, it's measured at the midpoint between the shoulder and the elbow. You can say it. Okay, so what you use your tape is, see, you keep your tape here, measure it down to the elbow, divide it by two. So if your examiner says you should do it, you must actually, you don't go and guess the midpoint. You must actually measure, you must do showmanship. Do you understand? But when you become a practicing doctor, it can be, you know. Also, we have the triceps skinfold thickness. It's measured the calipers though. But the first one is what we always use, the mid upper arm circumference. So if it is low, it shows you that there's muscle wasting, the person is not eating well, or the person has an underlying disease condition that has been troubling them for a very long time, so they are losing weight. If it's normal, it shows you that everything is fine. Protein stores, everything is fine. And they can use it to measure different people in a population to just access the total nutritional level, how will I put it? Status, total nutritional status of that community. Do you understand? So it's a simple, it's a low cost shit. It's just my take and everything, So it combines this and skin fold thickness to separate the fat from the muscles. But in children, you don't need to be subtracting fat like that. In children are not hitting the gym, they're not eating anything special. It's just the breast milk, you know. Of course, if you give supplement or if you feed a child well, of course you have bigger muscles. So I don't know if you understand. But in adults now that there are different people are eating, you see me now, some of my mates are bigger than me because maybe they are hitting the gym. Me, I'm only going to the hospital. Do you understand that kind of thing? You can't say I'm malnourished. You understand that kind of thing? So you have to subtract their fat and measure my own, which should be mostly only muscle, and compare. So it's widely used in nutritional assessment, geriatrics, that deal with old people, and chronic disease assessment. So I think that's what we got for the arm muscle circumference.